I'm Catherine Nutter. I'm the Program Director for the Diagnostic Radiology Residency. I'm also the Vice Chair of Education for the Department of Radiology. The key to being successful as a trainee in radiology and as a radiologist beyond is seeing a large volume of cases. There's something to learn from each and every case encountered. It's adding those little pieces together over time that counts and together shapes a trainee into the radiologist that they want to be. Our patients are our greatest teachers.
The pathology here is unparalleled. We're the only academic medical center here in Mississippi, and so sometimes things that are so rare that you'll have to do a little bit of research in order to read those studies, or even you'll be the one who's writing a case report about it. All of our pediatric patients come here, and all of the most rare diseases will come here.
Additionally, UMC is the state's only level 1 trauma center, and we also are a transplant center, which benefits both diagnostic and interventional radiology residents.
There's going to be cases seen every day that we as residents haven't seen before. Staff are always around for questions, whether they're in the reading room right next to you or just a quick message away. All of our staff are very open to questions and willing to teach.
I think the biggest strength of the program is that the teaching focus is all on the residents. There's only a handful of fellows, so everything kind of revolves around us. And I would say the training here is rock solid. Having completed most of overnight call, I would honestly put my R2s against any other R2 class in the country, and that's because of the volume and the complexity of cases that we start reading from very early on here.
We do a front-loaded first call, which means that we start first call 6 months into our first year, which is a little bit early compared to other programs, but I think it's very good in helping you formulate your search pattern and to get you prepared for the next few years while you're in residency.
So at UMC, we do several forms of research, some of which you might be surprised for a radiology department to perform. Of course, we look at bioimaging markers and predictors of disease, and we do this in conjunction with population health. And we work with several large population health studies across the nation. I'm also the director of a unique program in radiology, the Biomedical Sciences Graduate Degree Program. This is a combined residency and PhD program, one of only 2 formalized programs in the United States.
It allows you to pursue solid academic research career while training for radiology. So that's a great opportunity if you want to pursue a physician scientist career. I am working now in a gene therapy project. What we do is try to use ultrasound with microbubbles, which is a contrast agent that we use in ultrasound, to try to deliver drugs and therapy to specific tumors.
One of our biggest projects is establishing imaging biomarkers for metabolic disease. Another very interesting project that we're working on is a chemosensitivity assay that is essentially just like a bacterial sensitivity with antibiotics, and we can print a report to say this is the chemotherapy that will work with this particular tumor, and it personalizes chemotherapy. And then lastly, in terms of our basic science research, we look into image-guided gene therapy techniques for the treatment of cancer. There's exciting work here that a lot of people aren't familiar with and they don't know happens here, and this is a major plus of our program that I think many people overlook.
In the past 2 years, our interventional radiology division has experienced significant growth, both in terms of facilities, recruiting new faculty, and expanding our service lines.
This is the new interventional radiology department here at UMC. We have fantastic state-of-the-art facilities. We've got 6 new procedure rooms, which include 2 hybrid angio-CT rooms, just like this one here. We have a robotic single-plane angio room, a biplane angio room, a dedicated CT standalone room, as well as a standalone ultrasound room. We offer both the integrated and independent pathways in interventional radiology. Radiology is an exciting profession for me. I really enjoy the imaging aspect of it, the opportunity to make the diagnosis that no one else suspected, to alter the patient's outcome, and in particular, interventional radiology to be the agent of that outcome.
We also are going to benefit from the opening of the new Children's Hospital expansion, which is beautiful and has brand new pediatric imaging facilities that our residents will have full reign of and access to, and can benefit from all of those expanded modalities and all the updated technology, CT, MRI, ultrasound, all of the above available in the new department.
We have really enjoyed living in Jackson. It's a great place to raise a family. We enjoy low cost of living and relatively low traffic, which are the things that really make a huge difference in your day-to-day life.
It's a big city, if you will, for Mississippi, but it's kind of got the small town vibe, which is what I really enjoy about it. There's an abundance of things to do, especially if you're an outdoorsy type person. Hunting, fishing, we have the reservoir here, many parks and trails around that people take full advantage of for walking, hiking, biking, things like that. There's an area right close to the hospital called Fondren District, just a fantastic restaurant scene here in Jackson, all in a small town vibe.
The people keep me here, really. The camaraderie as a city, as a county, as an area is really unreal.
I think we really have a good residency program. It's like a small family. The other residents and I spend time together. Our kids play together all the time. I like the feel of it here.
Everyone is so nice. I'm not from here, I'm from Brazil. I got so surprised how people are nice here and everybody wants to help you and teach you. So it's been pretty good, pretty amazing.
Within this department, collegiality is so tight. That was one of the things that just brought me here. Getting to know these people, they become, as cliche as it sounds, like family.
Give Mississippi a try. People who are not from Mississippi may look at Mississippi not knowing what to expect. We have a very well-rounded program. We have everything you would need in a large academic medical center, but we're not that large of a program, so you do get the one-on-one teaching that you need.
The main reason I decided to stay here for residency was because this was the program that made me fall in love with radiology. There's a balance between patient care and academic life and personal life. And here, the procedural experience and the imaging experience that you get, I think is on par with anywhere else that you can train.
Thank you very much for taking the opportunity to explore our program and hear more about the opportunities that we have available here at UMC. We have the education, we have the faculty, we have the patients, so come grow with us.